Homelessness is a condition. It is not a characteristic of a person. We have a brother or a friend or a colleague who is experiencing homelessness. They are not a homeless person.
I don't have my own, I don't have a key. I can't have my grandkids to come see me. That's the worst feeling in the world.
I was sleeping in the park, in a abandoned bus. No one don't know what's coming in the bus while you sleep.
Homelessness and health are inextricably linked. People frequently become homeless because of a health crisis or because they're living with chronic illnesses.
I have a certain disease called syncope, as a passing out disease.
Well, I worked all my life. I lived in Bayside, Queens, until I had my first stroke. And that kind of slowed me down because I was in the hospital for 2 months.
We at Care for the Homeless believe that providing high-quality health care is essential to helping people end episodes of homelessness.
Imagine being homeless and imagining not having your health as well. I don't see how folks can fight the battle of experiencing homelessness if they're not healthy.
A lot of patients come in a little lost. Because of that, they tend to neglect their health. Us being here allows them to continue to pursue more fruitful endeavors, including work, as long as they have their health.
At Care for the Homeless, we work at our best when we're working at the intersection of empathy and effectiveness. Empathy is what brings us to the table in the first place. It's our inability to sit by as someone else is suffering. It's our outrage at the injustice of homelessness.
I see this as a passion and not just a paycheck. I'm committed to working as hard as I can to eradicate homelessness because on some level I understand what it's like to have nothing.
There's this misconception that the more money you have or the better position in life you live in, the better care you should receive, and that shouldn't be the case.
They look down at it. It's like you in a shelter, like, oh, you're the worst person in the world. You know what I'm saying?
You don't know what their ulterior motive is in life, in turn. They might have went through something just to try to get something. Let them get something just to get aboard. Let them get 10 steps ahead and stay out 20 in front. That's it.
I'm not saying be rich, but everybody should have something to eat, a roof over their head. Nobody's asking for nothing. I mean, what's wrong with that?
We also need to be working effectively. We need to be using programs and interventions that have demonstrated positive outcomes over time.
Our providers provide dignity and help break the cycle of homelessness, in my view, because they provide a level of care that is extraordinary and exceptional. They are going to see their doctors, and we provide the kind of environment that makes them comfortable in doing that.
Care for the homeless matter because people is in need, and everybody needs help.
We want to change the perception. We want to demonstrate that homelessness is solvable. Please join us in this struggle.